show you how I do that. And most people can get their cholesterol level down to 3.9. Some people, for genetic reasons, cannot. I'm going to show you why they can. And this is where medication becomes an important feature of management. So here you have that cholesterol clogging up the artery inside the heart, and that leads, of course, to a heart attack. Next slide. In the carotid arteries, as that plaque builds up, I want you to see this. Because in all of us, we all have some narrowing in there right now. Some narrowing already exists. All you need is for a piece of that to break off, go up into one of the vessels in the brain, and you're having a stroke. Out of nowhere. Yeah, 2 minutes ago, I feel fine, Dr. Meschino. 2 minutes later, I'm having a stroke. I'm having angina. I'm having a heart attack. How you feel and how you are can be very different. That's why getting these blood tests done is really important. And make sure you work yourself down into the ideal range. Next slide. This is really what I want to get across tonight. How the heck does that fatty, waxy material get into the blood vessel wall in the first place? Here's what happens. When you eat saturated fat and trans fats, hydrogenated fats, and fried foods, that those fats, once they're in the intestinal tract, they get absorbed and they travel through the lymphatic system and they go to the liver. Now the liver has a problem. The fat can't come out of the liver. It's stuck there because the fat can't dissolve in the water medium of the bloodstream. You know how oil and water don't mix? That's how it is. The bloodstream is water and the fat is like the oil. Can't get, so the liver can't store the fat or you get fatty liver degeneration. So what the liver must do is to package that fat, it puts a protein shell around the outside, and to make it float just right in the bloodstream, and this is what is the whole cause of the problem. It has to put cholesterol in this intermediate zone. Now, even if you ate a food that was cholesterol-free, which is terrible advertising, cholesterol-free. But if it has saturated fat or hydrogenated fats, trans fats, if it's a fried fat, then your liver has no choice but to turn on cholesterol production. Remember the slide I showed you how the liver made cholesterol? When does it do that? When saturated fat shows up. That's when it does it. Now, this little thing called the VLDL goes out into the bloodstream, and the saturated fat can get picked up by your fat cells, and your fat cells get a little fatter. But your muscles can also burn the fat and burn it as a source of energy. So what do a lot of athletes say to me? You know, this doesn't really apply to me because I burn it off. Take a look, I'm skinny as a rail, I burn it off, I got a fast metabolism. This is not having an effect on me. I can eat those foods that you're going to show me in 2 minutes because I burn it off. Have you ever heard of a marathon runner or a highly fit athlete? All of a sudden, they die of a heart attack on the treadmill, they die running the marathon, they die during a trip. Have you heard of this happening? Because often they don't pay attention. They think that the exercise gives them immunity, but it doesn't. Because what happens in this you can burn the fat off, but what's left behind after the fat leaves is cholesterol. Now we have what's called the bad cholesterol, the LDL cholesterol particle. And what's it doing there? It's doing there because you had saturated fat and you turn that cholesterol production on. You understanding that? If you eat the saturated fat, never would have happened. So now we go to the next slide. And now the LDL cholesterol is floating through the bloodstream. Some of it goes into your cell. See these receptors, these LDL receptors? Some of that LDL cholesterol will go into the cell and it can be used for all kinds of purposes. The cell needs some of it. But once the cell has all the cholesterol it needs, it shuts the doors, it stops making these receptors over here, and the cholesterol can't get out of the bloodstream and go into the cell. Now, people that have really bad genes for heart disease, often, genetically, they can't make these receptors. See these receptors here? They just don't make them very well. Those people need drugs to get their cholesterol down. Diet's not going to do it. But for 95% of us, that's not our problem. And 55% of people in this country have cholesterol in the undesirable range that's unsafe. 1 in 2 men die from cardiovascular disease, 1 in 3 women. It's not because of bad genes in 95% of the cases. It's because we have cholesterol levels that are too high. That extra cholesterol lodges in the artery wall and it causes the platy, waxy fat stuff to build up. Now when you're leaner and you exercise more, your body will make more of the good cholesterol, the HDL, which kind of vacuums up the plaque in the artery wall, takes it back to the liver, breaks it up, opens the blood vessel up. So I've got, this brilliant guy, Dr. Dean Ornish, who's an MD, who wrote this book called Reversing Heart Disease, proved with angiograms he could take people that had angina and serious heart disease, put them on a low-fat diet, get them to exercise and meditate. Now he gives them antioxidant supplements as well. He could actually open up their artery wall through lifestyle. Remarkable. So you can actually reverse some of the damage. The good news about this is the body is so forgiving. Until 87% of the artery is clogged up with plaque and cholesterol plaque, it's not even of any consequence. You're not going to die. So your body allows 80%, 87% blockage before it's even significant. So right now, if your blockage was 50% or 65%, and you stop it from going any further, you're fine. So because most of us in this room are in that range where we haven't had a significant event yet, you can stop the further progression by stopping an excessive intake of the following foods. Because these are the foods that contain saturated fat that do most of the damage. So take a look. So this is where the bad news really starts. And so when I was doing my master's degree in nutrition, we had a biochemist from the University of Columbia who showed me, the individual steps in the biochemical process that leads to that atherosclerosis in the artery wall. So at age 30 or 31, I'm saying to myself, oh my God, I've got to change everything about my diet. I couldn't do it overnight, of course. But these are the offenders, and so as you move away from these foods, you're doing yourself a gigantic favor. You see them on the board. They contain tons of saturated fat, all the way down 2% milk or higher, ice cream, whipped cream, cream cheese, cream in your coffee, there's butter, any cheese more than 4% milk fat, that's almost every cheese you're ever going to see. Regular chocolate, cocoa butter is loaded. Palm and coconut oil probably not are the worst offenders. We're not sure how much they raise cholesterol, but they do have saturated fat. And all saturated fat does is it makes your blood stickier. You know how everybody after the age of 50 has an aspirin deficiency nowadays? They got to be on aspirin to thin out their blood. When you eat a lot of saturated fat, it makes your blood sticky. When you're overweight, it makes your blood sticky. When you don't exercise, it makes your blood sticky. When you smoke cigarettes, it makes your blood sticky. How do you make your blood unsticky? You get lean, you exercise, you have less saturated fat in your diet, you have omega-3 fats from flaxseed and fish, and you eat more fish on a regular basis. You can make your blood much less sticky naturally, so that you don't need an aspirin a day necessarily, depending on your personal history. One egg yolk already has 250 milligrams of cholesterol in it. What does Dean Ornish say? You shouldn't have more than 150 milligrams of cholesterol on any given day. So 3 eggs is 750 milligrams. He's saying more than 150 a day, you're out of your mind. The egg white is great. The egg yolk, I don't eat them. You want to eat them? It's your business. But for me, not eating egg yolk. And then, of course, trans fats from creamy salad dressings and all these kinds of things. I'm going to take questions at the end if you can just wait. But I will stick around. That's good. So what's left? Not much. If I eat any more chicken, I'm going to grow feathers. But the reality is that these are the low-fat protein foods that should be the major focus. Now, chicken, turkey, fish, you know this. A little bit of seafood maybe, but it has some cholesterol. Be careful. Getting more soy products in your diet, I highly recommend it. You're going to see in the cancer model how important that is. Milk that's 1% or non-fat, same with yogurt. You say, what's the difference between 1 and 2%? A very big difference. 2% milk is 2% fat by weight and volume, but it's 36% calories as fat. They should have to put 36% on that part. But they get away with it. They can put 2. 1% milk's only 17% calories as fat. That's low. Anything under 20 is fine with me. Fine with Dean Ornish. Under 20, you're fine. So between 1 and 2, there's a huge difference. 1% is way better. And of course, non-fat is better than that. If you can find a cheese below 4% milk fat, God bless you. Good luck trying to find it. But they do exist. They taste like sponge rubber. There are some whipped cottage cheeses that taste like cream cheese that I've found by certain dairies that actually are quite good. And some people now use protein shakes to get your protein without fat, whey protein, soy protein. Anybody besides me doing something like that? Yeah. And egg whites, of course, just eating egg whites is also a very good option for you. In addition to that, there's some foods that can actually drag cholesterol out of your body. It's a bit complicated for me to explain how this happens, but there are foods that can actually drag cholesterol through the fecal route, and also the building blocks of cholesterol called bile acids, so that when you have a bowel movement, you're dragging the cholesterol out, and then your liver clears more cholesterol from the bloodstream, so your total cholesterol keeps going down, 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 down. You can lower your cholesterol, in many cases, by 15 to 20% by just doing what? Having half a cup of red kidney beans a day, or a bean salad, chickpeas. Apples, peaches, pears, and plums, tell me when your birthday comes. Oh. So when people ask you tomorrow, how was the seminar? You go, oh, pretty good, pretty good. What did you learn? Apples, peaches, you go, well, how much did you pay for that seminar? Oh, that was free, because if that's what, I knew that when I was a kid playing double dutch apple. So the fiber in those fruits help to lower cholesterol. And then if you want to sprinkle something onto your cereal, ground flaxseed. How many people already do that? 2 tablespoons a day. Good thinking. And also psyllium husk fiber, which is the active ingredient in Metamucil, but you can buy, it's a bulk and put 2 to 3 teaspoons a day into some juice. Also lowers cholesterol, is also a good fiber for cleansing the bowel. And the salmon grain contains a cholesterol-lowering fiber. There are 2 natural active ingredients you can use as supplements. I put them together into one product called Cholester-X. Because a lot of people don't want to go on cholesterol-lowering medications right away. They're saying, is there something natural that I could try first to get myself into the ideal range? In India, the drug for cholesterol lowering is gum google, also known as goo-goo lipid. You know, what's that, baby tongue? Is it like tablet? What is goo-goo lipid? Goo-goo lipid is a resin that comes from the mucomyr tree that in the body gets the liver to clear more cholesterol from the bloodstream and dump it into the intestinal tract so you can excrete it in fecal matter. It lowers cholesterol extremely well, and the artichoke leaf extract helps to move the cholesterol through the liver into the bile duct so you can get it out of the body faster as well. And so when you combine those 2 things together, you can lower your cholesterol by 20% in 4 to 6 weeks. How do I know that? I had one of our doctors call us, a little while ago. He's an alternative health practitioner, not a medical doctor. And he said, one of my patients came in with high cholesterol, and the doctor just wrote a prescription for Lipitor, and she was sort of afraid to take it. He says, Dr. Joe, is there anything natural that I can do? So he said, well, my patients do pretty well with this Cholester-X. It has gum google and artichoke leaf extract. Why don't you try this first? And if it doesn't work, then I think you're going to have to go on Lipitor. She says, okay. So she takes it, and she doesn't even take the full dose. She only takes 4 capsules a day, like people that take 6 capsules a day. And she goes back to her doctor for follow-ups just 6 weeks later. And her doctor runs blood tests again. Doesn't tell the doctor she's not on Lipitor. She's afraid to tell him because he knows he's going to get mad at her. So doesn't tell her. So he does the blood test and says, look at that, Betsy. Your cholesterol's down by more than 20% in 6 weeks. You see what that Lipitor can do? And she's going, okay, yeah, good, really good. Thanks a lot, Doc. Goes back to the doctor. Dr. Joe, you can't believe what happened. So he picks up the phone and calls me. So